While commissioning the Sunbelt Mining Group Limited factory at Nanyudik village in Rupa Sub-County, Matheniko County in Moroto district, President Yoweri Museveni expressed his gratitude to the people of Karamoja for voluntarily surrendering the illegal guns in their possession that has ushered in peace, thus attracting investors into the area. The plant, that currently employs 120 Ugandans, sits on a 3.3 square kilometer piece of land and produces marble floor bathroom and kitchen tiles of all sizes. It is estimated that 560 million metric tons of marble are available in the area. The president noted that because of peace, the region is today witnessing a lot of development activities like the tarmacking of the major roads, availability of electricity, and a booming construction sector. The president assured the people of Karamoja that government is going to tarmac the road from Moroto, Kotido, Kebong up to the Kenya border, and also the road from Kitgum Namukora Karenga to Kidepo National Game Park. Mr. Museveni further disclosed that he has held discussions with his Kenyan and Ethiopian counterparts on the possibility of constructing a road through Kenya to Ethiopia in order to access the Ethiopian market.
So, those marble tiles which I saw, once the Ugandans know, I'm going out to advertise for you. They simply don't know this wonderful marble. You put it on the floor, it will be there for 3,000 years.
The president, however, encouraged the people of the sub-region to cooperate with the investors and noted that a lot of time and development opportunities had been lost because of insecurity. He said leaders of the time thought that cows were the only wealth available, yet a lot of minerals that equally generate much wealth are available in the area. President Museveni also paid tribute to the Chinese investors for coming to invest in Uganda, assuring them of many opportunities that exist in the country. He assured them that their concerns that include the voltage of electricity to the factory will be addressed. On the coronavirus, President Museveni reiterated his call to all Ugandans to strictly adhere to the rules and guidelines provided by the Ministry of Health and assured the nation that once the guidelines are followed, the virus will definitely be defeated.
So that's why I have advised people, if you have a flu, even if it's not corona, but if you are coughing, sneezing, don't go into the public. Stay at home.
Minister of Energy and Mineral Development, Honorable Mary Chitutu, noted that there is a lot of mineral potential in Karamoja sub-region. She thanked the president for the infrastructure in the area that has eased movement. She said adequate power would be available to the investors in Karamoja by June 2020. The Deputy Coordinator Operation Wealth Creation, General Charles Angina, said their main concern now is to add value to agricultural and mineral products. Other speakers, who include the LC5 chairperson Moroto district, Peter Ken Lachop, thanked President Museveni for the development programs the NRM government has extended to the people of Karamoja sub-region.
The people of Karamoja sub-region in northeastern Uganda still upholds African tradition and culture of eating and drinking in a pool and regularly shake hands. According to the Minister for Ethics and Integrity, this puts the sub-region at a high risk once the virus spreads to the area.
People have got what we call a socialization character. We live communitarianly, okay? Karamojong will never walk alone, and they will always greet, handshake, they will always hug very intimately. So they become more precarious should this virus drop into the soil of Karamoja.
The minister says low sanitation practices coupled with porous border points is another factor.
Karamoja is the most vulnerable. One, it is a place that has very low sanitation percentage. Two, they are also bordering international borders where it is already said the virus has reached. Kenya, the oil belt from Amudat up to Moroto is having bordering Kenya, actually up to Kabong. And then the entire Karenga district is bordering South Sudan.
Similar concerns were also expressed by the woman MP for Nakapriprit, Esther Anyakun.
In most cases, our people in Karamoja don't have televisions, they don't have radios. But of course, this should not remain at only these media houses. I would also want the LOC ones of each village to take up this responsibility to make sure that they sensitize people in their villages, because our people believe so much in their LOC ones. So this message should go down to the grassroots to sensitize the people about the outbreak of corona, the symptoms, and also the preventive measures for this disease. So to me, it is awareness is not yet so much in the region because of lack of some of these facilities. But
the deadly coronavirus that broke out in China December last year spread through body contact, and Uganda has so far confirmed 18 cases.
I want to emphasize, like my colleague said, the preventive measures. Sure. Because in this country we cannot afford those overwhelming numbers you are hearing. Like in South Africa, 700. In Egypt. Like you are hearing Egypt is around 450 something. Like in
Cameroon,
Europe,
Ghana,
they are not very far from us. But I think we can't manage those numbers. So we must intensify the preventive measures so that we keep these numbers as low as possible. Our teams will do the best they can to make sure they identify all the contacts and make sure that the contacts are advised to stay isolated, so that we keep monitoring them and testing them so that they do not spread the disease into the country. If you realize, apart from the Ajumani case, which is still tricky to us, but we also believe it was an importation from a neighboring country, most of the cases in this country are imported cases. So if we can restrict and control where we are now, we are likely to be safe or to reduce the numbers. But if we do not control them now, then these same people can cause more cases in the community, and in that case now we shall go in a very big problem. So our emphasis is, please, let's continue washing hands, avoiding shaking hands, and also we are advising people to stop treating themselves. We have heard of stories, people are buying azithromycin, chloroquine and what. Please, if you are sick, go to the health facility, you will be helped. Stop treating yourself. You may even cause resistance for something which was easier. And finally, I also want to emphasize the issue of the stigma. Let's not stigmatize our people. If we are to encourage them, let's encourage them to go for help in official health facilities, but let's not harass people because they traveled also and so came back from Dubai yesterday. Let's not harass people. And let's stop the anxiety. Let's stop the anxiety within the community. This is a disease which has come, it will pass. And if you are sick, you can be helped. We know that many survive. So let's stop the anxiety, because the anxiety is really very high. And actually, the bigger problem we have now is anxiety. So let's stop the anxiety.
The Nurses and Midwives Union plans to deploy an e-service solution that is premised on localized deployment to mitigate the spread of COVID-19. The President Ugandan Nurses Union, Justus Cherop, says they have got the capacity to deploy nurses to different parts of the country.
To avoid those cases is that we locate a nurse within a given locality, a village and a sub-county, a parish, like that, which we have. And that 60,000 nurses can confront this properly and give us a good report.
Government must apply masks and other protective facilities to facilitate health centers in rural areas.
I am calling upon the whole nation that if they have involved army and the police and the prisons, they are very prison wardens, they are very good, because order Nimoja, they are stubborn Ugandans who cannot listen. That now they have given you that put of masks and you are not putting on. Now, we need order Nimoja in this country so that if you will say do this, do this. So we are involving them, or the government has thought it very wisely to involve them to enforce, to reinforce the directive of the president.
The National Coordinator for Safety and Health at Ugandan Nurses and Midwives Union, Peter Habyarimana, advocated for motivation of health workers.
They should develop or form a committee of psychosocial support, always to move, not only to concentrate on prevention of coronavirus, but also to look on the other aspect of life. Life is very important. It is given by God. To the government.
The National Treasurer, Ugandan Nurses and Midwives Union, Birungi Annette, said the app is free.
This app, which the Ugandan Nurses and Midwives Union is talking about, called Zokto, works like the way you see Uber. And what is it that I'm trying to stress out? We already have the strength. We have the nurses, 5,000 nurses qualify every year. A nurse is a qualified person who cannot be challenged with any other local person. So if we use this strength of having already our nurses, you equip the nurse, you save the nation. That is the motto that Ugandan nurses have come up with.
Ugandan Nurses and Midwives Union has 15,000 members registered in the Zokto app.